Hi everybody, my name is Aparna, and for my research project I decided to look at price transparency as pricing reform in healthcare. So I'll start by saying the US spends a lot of money on healthcare. That's us, and this is the rest of the OECD. Now, despite the money, we don't actually get better care. We're just overpaying for our care because the prices themselves in our healthcare system are too high. Now, in the US, we try to regulate these prices from the bottom up through the free market and consumer-directed initiatives like price transparency. The idea here is that if a patient has the price tags for different providers, they'll pick the cheapest one and force the other providers to lower their prices and compete. Price transparency is also meant to narrow the wide price variation we see across the country for particular medical services and prevent patients from getting surprise medical bills. In the past 2 years, this idea of price transparency was codified into the Transparency in Coverage federal rule. Under the Administrative Procedures Act, Congress grants rulemaking power to different government departments, and they figure out the logistics of how to implement an executive order or a law. This particular rule forces insurance groups to publish their negotiated rates and patient-specific price estimates on a self-service website. I wanted to understand how and why this policy was passed, so I decided to look at the rulemaking process, particularly where the government gets feedback from stakeholders through a public comment period. After the proposed rule was published, 174 stakeholders submitted official comments on letterheads. There were also over 20,000 anonymous public comments that supported price transparency broadly, but didn't engage critically with the provisions of the rule. So the real negotiation happens in those letters. Of these letters, the majority came from clinical care groups like hospitals or provider organizations. The next biggest contributor was the insurance industry, followed by infrastructure groups like electronic healthcare record companies, hospital receptionists, etc. The common thread here is that these groups have financial skin in the game. Either their revenue or their jobs are at risk because of this rule. And while the rule is meant to benefit patients, there were really only 8 letters from patient representative organizations. Some of the key themes in the letters were that industry groups felt the rule would lead to too much administrative burden for a tool that wouldn't even be used, and stakeholder groups like providers and payers went head-to-head trying to protect proprietary information, arguing that the other would use the information to increase prices and collude. But on almost all of these issues and some other nuanced critical decisions in the rule, we really don't know what patients want. So there are 2 big takeaways. The first is about price transparency and the rule itself. The literature shows that existing price transparency tools have very low uptake, so the rule likely won't lead to enough consumer pressure to actually lower prices. It also doesn't address the root causes of problems like surprise billing. All it really does is put the cost-cutting burden on patients who, in our healthcare system, have the least amount of decision-making power. The second takeaway is about the rulemaking process. We worry a lot about big money's pull on Congress, but policies get fleshed out in rulemaking, and there's bias here too. The process is filled with jargon, hundreds of pages of documents, and is really only accessible to groups, like hospitals, that are aware of the process and have the resources to navigate it. Also, concerns are acknowledged in the final rule, but very few changes are actually made in response to the comments. Based on these conclusions, I have 2 policy proposals. The first is to include patient education and outreach in the rulemaking process. The second is to regulate healthcare prices from the top down, rather than relying on patients as consumers. Now, the last thing I want to do is look at the big picture. Price transparency and the Transparency in Coverage federal rule seem to push off substantial top-down change in our healthcare prices and treats consumers as scapegoats. But the rule does force providers and payers to reveal their negotiated rates, and it gives policymakers the data they may need to understand and solve these problems in our pricing system. It's really a great example of choosing incremental change over large-scale structural change. So the questions I leave with are whether or not industry groups can continue to afford multiple rounds of incremental change like this, and whether patients can continue to wait for structural change while bearing both expensive medical care and the burden of cost control. On that note, thank you for listening, and I would love to answer any questions online or offline.